Hey, to all my ladies out there, how many of you guys are frustrated because you are experiencing a block with penetration? Either it's with trying to engage in sexual activities with your partner, or perhaps even with yourself and you're using a dilator or a device and it just feels like something is there. There's a wall that you cannot get past. And perhaps you've gone to your gynecologist and they've said there's nothing there, it's fine. Maybe, have a glass of wine or something like that and just try and relax. But everything from an anatomical standpoint from your GYN is totally normal, but you're kind of like, there's something there. And it's not my head. It's not in my head. So we're gonna talk a little bit more about what this is and what you can do to actually help yourself and get some improvement in this arena. Now, we first have to talk a little bit about anatomy because there are many of you who have no idea of anatomy at all. Maybe some of you have some experience, but we're gonna first start at the pelvis. Now, the pelvis is like this heart-shaped circular structure that you can see here that has an opening inside. And this is where all your pelvic organs sits, like your bladder, your uterus, and your rectum. And it's encased in this bony pelvis. Now, the pelvis is made up of a couple of different bones. There's two iliacus bones, which is here and here. And then in the back, there's this cobra head type structure called your sacrum. And then down below is your tailbone. And these form three joints. You have your sacroiliac joint, two of them. And then in the front, you have your pubic bone. Now, the other thing I have to mention is your spine sits on top of that sacrum. So for a lot of people, this joint, which is your fifth lumbar vertebrae, is actually attached to the sacrum too. So sometimes this is involved. Now, if we look inside of this pelvic structure, you see all this red stuff. This red stuff is known as your pelvic floor muscles. Pelvic floor is a group of 14 muscles that basically line the inside of your pelvis that is responsible for pelvic organ function as partly some of the things that it does. Now, if you look at this is the side of the body. This is indicating the pubic bone, and that is the tailbone. So you're kind of looking at this from the side, and if you cut it in half, you'll see the organs, which is your bladder, your uterus, your rectum. And this red line over here is a simplification of the 14 muscles of your pelvic floor. And you see it kind of goes through all of the tubes, the rectum, the vagina, and the urethra of those pelvic organs. Now, if these muscles are not quite right, and we'll talk about what that means, then it can interfere with everything that is bladder related, to sexual activity, to having a bowel movement. And that dysfunction or the problem that can happen within those pelvic floor muscles is actually tightness. And these muscles, when they become tight, and we'll talk a little bit later about why these muscles become tight, but when they become tight, they can actually create difficulty with any type of penetration. You can see here that the pelvic muscles, even though there's 14 of them, they're actually 3 layers of muscles. So you have the superficial layer, which is right in through here. It goes around the vaginal opening. It also goes around the rectal opening. And then you have a deeper layer, which is here, which is your third layer. And then you have another layer in between that you can't quite see in this model. But if any of these muscles are spasmed in any point along the way, then you can see that if something is trying to penetrate, but there is tightness around here, that it is going to feel like a wall when something is trying to penetrate through and it can't quite kind of open up and be supple. Like these muscles aren't supple enough to allow something to penetrate through. And this could be causing the block or the wall that typically most people feel, especially if you've already gone to the GYN and they're like, there's nothing wrong, we don't see anything. Now, for some of you, maybe you haven't gone to the gynecologist. So one of the things to maybe talk to your gynecologist about is to make sure that the hymen, which is there's usually a flap of tissue that sometimes if you haven't had intercourse, then that can end up creating some type of block or wall too. And if that hymen hasn't been basically broken, then that can sometimes create that wall sensation. So if you've gone to your GYN and you ask them, hey, is my hymen okay? And they're like, yeah, everything looks fine. Then chances are what's happening is that these muscles have become tight and restricted and nothing is going through. Now, why does this happen? Now, this can happen for a host of reasons. For many, this has started in their youth, where everything from maybe being stressed or having maybe some low level or even high level anxiety can actually create tightness within these muscles that you may not even realize. And for some people, there can be anxiousness, possibly even around when you were younger, having a bowel movement and having constipation issues, where maybe you were afraid to go to the bathroom, or maybe you were afraid to go to a public bathroom and you held things tight. So that could be one of the reasons, and that tightness has kind of like followed you throughout this time, and now you're trying to engage in activities of penetration and it's difficult for you. For some people, it could be postural changes. Now, your body, muscles are interconnected throughout from like head to toe. And for some of you, perhaps your posture changed because of either a fall onto your tailbone, maybe you had a sports injury, or maybe you just hold yourself in a very tight postural state when you were younger, or now even perhaps when you are at a job where you're sitting all day and you're sitting on these pelvic muscles. They can also become tight and restricted, and when that happens, it can create tightness within the muscles of the pelvic floor. Now, those pelvic floor muscles, they don't typically work by themselves. So for a lot of people who come to our clinic that are looking for treatment to help improve the tension within these pelvic floor muscles, what we also typically see is a lot of the other muscles that attach in and around the pelvis. And there are a lot of muscles that attach around the pelvis. These are just a few of the deeper muscles. This is indicating your pelvic floor muscles. Again, here's your pelvis that you quite can't see. There's the pubic bone, there's the tailbone. But your pelvic floor muscles work with a lot of other muscles that attach in and around the pelvis. These are some of the deep hip muscles right in through here. You've got your low back muscles in there. But check this out. You also have a whole host of other muscles that, attach to the pelvis from the front, like your quadriceps. You've got your hamstring. You have your inner thigh muscles right in through here. You have your abdominals. And for many people, these muscles also have become restricted or tight, then creating a compensation for these pelvic floor muscles to also become tight. So there could be a whole host of reasons why this has maybe happened in your past. And so if that's what you're basically kind of like, that might have been me, then this is most likely what is happening. Now, for some of you, if you're having this block, you might also be noticing other symptoms, not all of you, but maybe some of you, such as constipation. Because again, if those pelvic floor muscles go through those pelvic organs in that picture that I had showed you before, where these muscles have become tight, they may create constipation because tight muscles are clamping down the sphincter, not allowing stool to be able to easily pass through. But they can also cause bladder issues. And for some people, it can be feeling like they can't empty their bladder easily. Or for others, it can be that they're having pain with urination, or they're peeing all the time. They have urinary frequency. So that could also give you another indication that, hey, this might be due to these tight muscles of the pelvic floor. So what do you do about it? Now, it's easy enough to basically say, hey, when you have tight muscles within your pelvic floor, what you have to do is basically make them untight. And that is exactly true. That's what we need to do, is we need to create suppleness in these muscles to get them softer, to get them more flexible, to allow better blood flow, so that if there is pain associated also with that block, so pain with penetration, that all that blood flow and improvement in flexibility actually allows a lot of these muscles to start healing and repairing themselves, so that then it's not painful either when you are trying to have intercourse, and it feels more pleasurable than it feels uncomfortable. Now, working on these muscles is not exactly easy. It's not as easy as saying, go home and do this stretch, because these muscles are deep within the pelvic cavity. And so it does take a specialized person, typically like myself, to really look at this, go intravaginally or intrarectally, and actually assess a lot of these muscles. But for many of you, you may not have access to someone like myself, or perhaps you already saw someone like myself and it didn't actually really help. And so for those of you who maybe don't have access, you're looking for a new avenue of how you can deal with this yourself. Perhaps it's not financially affordable for you to go to have this treatment done, because sometimes it takes time. then we have created an online program, which is in the link down below, specifically made for you to actually work on this at home. And for some of you, maybe you had pelvic floor therapy where they went internally and they did some of the work, but it didn't quite take care of a lot of the symptoms. And usually the reason why is because, remember when I said a lot of the other muscles around the pelvis that attach to it could be involved? For many of you, that could be one of the reasons why, is because there's still a lot of imbalances in the other muscles that attach in and around the pelvis, preventing from these pelvic floor muscles of completely relaxing and becoming flexible and allowing that repair and blood flow. And so for those of you who are experiencing that and you're like, yep, that is definitely me, then the link down below where we take you through a 6-week program of really how to work on this yourself at home can be invaluable. And it can be such a good adjunct too with what you potentially are already doing yourself if you're not doing anything. And of you who are frustrated, you're not really getting answers from your GYN, then the link down below where you have access to our online program could be an amazing solution for you. Now, for some of you, you might have a more complex history, or you're just like, I'm not quite sure if this is me. And for some of you, and we do this for people all around the world, nationally, internationally, where we do online video consults with you, where we can actually listen to what's going on, really take a thorough history, maybe really dive into your past to figure out what has caused what's going on now, and what are the next best steps. Because for some of you, maybe the online program isn't quite appropriate because you're in a lot of pain. Or maybe you've tried having treatment with someone like myself, but it hasn't quite actually helped. So we need to figure out, is there something more that you need, such as do you need to be looking at another type of physician or nurse practitioner that is also going to help you overcome this? So we work with a lot of a variety of nurse practitioners and physicians, especially in our area, that can help. Some of them even do online consults. So we really need to figure out what might be going on with you. And if that is what you need, then there's also a separate link down below where you can actually do a video consultation with us. And if you do choose to do the female pelvic pain program, which again, the link is down below, there is a way to piggyback that consult for a discounted rate onto that as well. So I hope for some of you, this was really helpful in creating that insight of what might be going on. And if this was helpful for you, please subscribe. Send us questions that you have down below and comment, because we use those comments to create these other videos. And if this isn't for you, but it's for somebody else, please share and like this video, because it can be invaluable to so many people to know this information. Because of course, educating yourself is one of the keys to really improving your life. So I hope you guys have a wonderful day, and stay tuned for any of our other upcoming videos. Take care.